Hello, everyone. This is another Freedom to Feel conversation, and my guest today is Dr. Michael E. Platt. He is a board certified in internal medicine and has nearly 4 decades of experience working with patients. Dr. Platt, a specialist in natural hormone replacement, has successfully treated thousands of patients worldwide. He's the author of the popular Miracle of Bioidentical Hormones and his latest book, Adrenaline Dominance, a revolutionary approach to wellness. And he has another one, actually, I want to mention Platt Protocol. So there are 3 books out there. The one that we'll be speaking about today is the Adrenaline Dominance. So the full bio will be at the end. This is not everything about Michael. There's a lot more about you. So all the information will be on the podcast notes and at the end. So the question that I love asking everyone, and I'll ask you too, when I introduce them briefly my own way, how would you introduce yourself? Who is Michael in this very moment, in his own words?
Wow. Um, well, just a person that has a passion for medicine
Yeah.
and getting people well. It's very rewarding,
Mm.
and unfortunately, we don't have a good medical system in this country. I don't know if you're aware of this. We're on the bottom of the list of healthcare of
Mm.
all civilized countries. We have
Wow.
the worst healthcare of any other civilized country.
Wow.
And a lot of this is because I don't know if I'm allowed to say this, but big pharma.
Yeah.
And they have control not only of what doctors learn in medical school, they control the medical boards, they control everything.
Yeah.
And their interest, of course, is for people to be sick.
Mm.
That's how they make their money. So
Yeah.
doctors are not trained to treat the cause of illness. And they get no training in hormones, even though hormones control everything in the body, everything.
Yeah.
And unfortunately, doctors that have the least knowledge of hormones are gynecologists, and that's who women go to see.
Wow.
So it's not surprising,
Yeah.
you know, in essence, that why we do not have a good medical system.
Yeah.
So, what I have learned over the, it, is that when you treat the cause of illness, that's how you cure people.
Right. Right.
Um, so, so
Wow.
that's so here we're talking about hormones, and today we'll be talking about adrenaline, which is a hormone. It's also a neurotransmitter, but it's something that everybody's heard of,
Right.
but nobody really understands what adrenaline does in the body. They know that it's what they call the fight or flight hormone, but people are very rare. It's rare for them to be in danger.
Right.
So, so the main function of adrenaline is not to help people when they're in danger. The main function of adrenaline is to raise sugar levels for the brain.
Yeah.
And people don't realize that the brain uses more sugar than any other tissue in the body.
Wow.
And anytime the body detects that the brain is running out of sugar, it puts out adrenaline
Yeah.
to raise sugar levels. And so, what people are not aware of is this constant release of adrenaline affects the body.
Oh yeah.
And we'll talk about all the conditions that adrenaline is causing, which is unknown to the medical system.
Yeah, it kind of makes me sad, I have to tell you, when I hear that the system is not really made to care for people's health. So it's all about treating the symptoms because it's profitable. So that is really a yeah, you just got me. I have heard it before, of course, but every time I hear it again and it sounds like the truth hurts, doesn't it? So, what is your vision? I know I have so many questions here about adrenaline. Yes, I want to get there. But what is your vision? How can we contribute to, I mean, to a world or a country that focuses more on wellness and well being and less in illnesses?
Well, the only hope is that people have to get angry.
Yeah,
They have to demand better health care. But,
right,
here we have a president that's trying to destroy the healthcare system.
right.
It's tough out there. It really is.
Yeah,
But if This is what people want. This is what they're getting what they're paying for.
How do you define health these days? What is to be, I have to ask you this question too. What is to be a healthy person? How, you know, not even when it comes to the whole person, not speaking just of physical health, but I'll leave that to you. What is to be a healthy person?
Well, you're right. I mean, physical health is a big part of it,
Yeah.
but emotional health is
Mm.
important,
Yeah.
and joy of life.
Do you have any spiritual views of yourself in the world? Have you ever contemplated the idea that we are not just physical, that there is more to this experience?
Well, it's a big. I mean, the emotional part is a big part of
Mm.
being healthy,
Mm.
and it's hard to say. I
It's interesting that you talk about emotional health. Yeah, I just spoke of spirituality, but it is very much connected. Actually, everything's connected. There's nothing
well,
that it is, yeah, disconnected.
yeah,
Right.
and what people should understand is that adrenaline has a big part to play in emotional health.
Right.
Um, you've heard of people that have anger issues,
Mm.
road rage. That's
Yes.
all caused by adrenaline.
Oh,
Um, Internalization of anger is a major cause of depression.
right.
So adrenaline also leads to depression.
Right.
And you may have heard of something called anxiety.
Mm.
The
Oh, yes.
only cause of anxiety is increased adrenaline.
Ah,
So,
right.
it just goes on and on. But yeah,
So talk to me about that. Let's begin. For those who don't know what that is, what is adrenaline dominance?
there's another term called estrogen dominance.
Mhm.
And that was coined by Dr. John Lee, who's no longer
Yeah.
with us. But um, so adrenaline dominance is when the body has too much adrenaline and it affects the person's health. That's adrenaline dominance. And I mentioned anxiety, but people have problems with insomnia. The
Yeah.
number one cause of insomnia is increased adrenaline. So, and it starts at a really young age. You may have heard of colic in babies.
Mm,
That's adrenaline.
right.
And that can actually be eliminated in about 5 minutes. Mother doesn't have to stay up all night with a crying baby,
Mm.
but but there's a way of lowering adrenaline very quickly.
What is there a connection between adrenaline and cortisol?
Very big connection.
Talk to me
Um,
about that.
Adrenaline is a very powerful hormone, and the body actually adrenaline levels peak at 2:30 in the morning. And
Ah,
the reason why is that the brain basically runs out of sugar around that time. And when the body releases adrenaline, because it's a very powerful hormone, it
right,
creates a lot of stress to the body.
right,
And the body responds to stress by putting out cortisol.
right,
And so the first thing cortisol does, it also raises sugar levels. So
right.
now you have adrenaline that raises sugar levels. You have cortisol that raises sugar levels. And the whole thing about sugar is that it doesn't matter whether you're eating sugar or the body's making it. If you don't burn it up, all that extra sugar goes into your fat cells. So,
Ah,
you talk about weight gain. A lot of people are concerned with weight gain. And here they're actually gaining weight while they're sleeping and they're not aware of that.
wow.
Again, our friend adrenaline.
So what what comes to me is the balance, right? Isn't it something that the body keeps searching to return to balance? So that's the whole. It seems like that's the whole goal, purpose, right, of the system, the physical system, the body. So is that something that's possible? How can we achieve that? Is balance, let's see, a destination, or it's a dynamic kind of realm that we get there and then we get out of there and then we learn how to go back? How does it work, this idea of balance when it comes to hormones?
Well, um, once you understand the role that hormones play, um,
Yeah,
you will understand when you have too much of a certain hormone,
yeah.
and at that point, then you need to balance it. For example, estrogen to me is a very toxic hormone.
Ah,
It's the most commonly prescribed hormone,
right.
but it's not a happy hormone.
Mm,
And that's where breast cancer comes from, and cancer of the
right.
ovaries and
Yeah,
uterus and whatever, and
yeah,
and it causes weight gain around the hips, thighs, and buttocks,
right.
um, anyway, and it causes cramps and PMS and breast tenderness, and so it you know so if you know that you have too much estrogen, then you need to balance it with another hormone called progesterone.
Mm, yeah.
So so uh, so what you're saying, balance is important, but you can only achieve balance if you understand what the hormones are doing.
Right.
Um,
That's true. That means that we have to do the exams, right, Michael? That's important to go through
yeah.
those initial exams to know blood exam, the hormone panel, I think they call it, right?
Well, a hormone panel is okay. Um, you can just sit down and talk to a patient and understand what their hormones are doing. But when it comes to doing hormone panels, you have to be very careful because the majority of doctors do what are called saliva tests.
Oh,
And the problem is, since so many people have excess adrenaline, one of the things that adrenaline does, um, it cuts off circulation to areas of the body that are not needed for survival. And the
right.
salivary glands are not needed for survival. So
Mm,
adrenaline actually cuts off blood supply to the salivary glands. So
yeah,
when they do a saliva test, very often they get what's called a low cortisol level.
right.
And you may have heard the term adrenal fatigue. Well,
Yeah.
that's a non existent condition. If
Mm,
they did a blood test, they'd find the cortisol level is actually high or
right.
normal. So I'm just saying that, but
Wow.
there's such a lack of knowledge about hormones by doctors that
Yeah.
it's
Gosh.
scary, frankly.
Yeah. So thank you for doing the work that you're doing now. I know you're already retired, actually, but you're still working at the purpose to help others with education, knowledge. So what can we do then? How do we know when we um, too much adrenaline, when the excess of adrenaline it's taking over? Oh,
Okay, well, again, it's a matter of knowing what it does.
right.
Now, remember I mentioned it's a powerful hormone.
Yeah.
So people with excess adrenaline, what they'll find is that they um, they may notice that their knee taps up and down when they're sitting down. That's
Mm.
always excess adrenaline. Um,
Ah,
they'll have a lot of tension in the back of their neck. They'll be quick to anger. They
oh,
may have trouble sleeping. They may grind their teeth at night.
right.
Um, they have a thing called restless leg syndrome. Um, so whatever, but um, and anxiety.
Yes.
Again, there are a lot of clues as to a person having increased adrenaline.
Right.
You
Yeah.
don't need to do a blood test.
Another question is, do you recommend diet, that we change our diet? I know your website has so many products that when I looked at them, I'm like, oh, maybe I need some of those. I don't know. Let's see how I feel after our interview. I will investigate more. But talk to me about that diet. Would that help when it comes to
It,
excess of?
diet is incredibly important when it comes. If somebody has a lot of adrenaline,
Yeah.
I mentioned briefly in the beginning that about treating the cause
Yes.
of problems. And
Yes.
if somebody has excess adrenaline, you need to treat the reason why the body's putting out adrenaline. And
Right.
as I mentioned, the body's using adrenaline to raise sugar levels
Right.
in the brain.
Oh,
Um, so, so, so one thing that you need to do is to provide the brain with the fuel that it needs,
mm,
so that the body doesn't have to use adrenaline
right.
to provide the fuel.
Right.
So the brain uses two different fuels. One is sugar, and the best source of sugar comes from vegetables. And the reason for that is that because the sugar from vegetable don't cause the release of a lot of insulin.
Right.
And insulin is another toxic hormone that we should be talking about.
Mm,
But it's the number one reason why people gain weight is insulin.
yeah.
Um, it puts on fat right around the middle.
Right.
The And it speeds up the aging process.
Mm,
So it's not a happy hormone. Um, and
yeah.
then I mentioned before that estrogen also not a happy hormone. And what's nice about progesterone cream, and we'll be talking about that, is that not only does it block estrogen, it also blocks insulin. And
Mm,
it's the hormone that
mm,
blocks adrenaline.
oh,
So it's such an incredibly important hormone that nobody really talks a lot about.
So yeah, I went on your website and I saw that. Yeah, the creams, right? You so we don't really. I didn't see that, but do you also have supplements, something that we can take, or it's just topical? The,
Well, no, there's also a meal plan on the website.
yeah, on your book
A
too.
meal plan to lower adrenaline.
Yeah,
I mentioned that sugar is an important, you know, element to give to the brain, but the other fuel that the brain uses, which is even more important than sugar, believe it or not, are ketones.
ah,
And the best, you can get ketones directly from coconut oil or something called MCT oil,
right,
medium chain triglyceride oil.
right.
So so if somebody does have a problem with excess adrenaline and wants to improve from that, then they need to add the vegetables, the coconut oil, the MCT oil. And let me tell you something. You've heard of ADHD.
Yes.
Okay, well, in my book, the Adrenaline Dominance book, I talk about the good, the bad, and the ugly.
Yeah.
And the only condition I put in the good section was ADHD.
Right. Yeah, I see that. Yeah.
And because the most intelligent, successful, creative people in the world have ADHD. So
Mm,
how bad can it be?
mm,
Um, and the thing is, it's not a learning problem. It's a um, you know it's it when people have trouble focusing,
yeah.
that's ADHD.
Right. Right.
And so it's really a matter of um, they're not being able to focus. So, but you can get rid of ADHD in 24 hours just by lowering adrenaline levels.
Right. But in this case, we don't want to, right? ADHD, if it is a good
Well,
thing.
no, no, the intelligence will still be there,
Ah, oh, good. Without the
and the
bad.
creativity. Creative people actually have the most adrenaline,
Ah,
and this is why people in the music industry and
mm,
a lot of drugs and alcohol. And,
yes.
and people do drugs and alcohol just to relax, just to chill out when they
Yeah.
have a lot of adrenaline.
Yes.
So,
That's so interesting. So interesting that you say that. One of the things that I mean, I don't know if you heard, have you came across the relationship that in medical school? I just interviewed somebody who asked me to take sulforaphane. Sulforaphane is that compound in broccoli.
I'm
Uh,
sorry.
sulforaphane, I think sulforaphane. It's a compound in broccoli that, in cruciferous, I think specifically in broccoli, that helps us prevent cancer. But then she said that's also very good to balance estrogen. So I've been taking it. So have you heard about that, Michael? No,
I,
the compound in broccoli that's really good to balance estrogen.
I'll be honest with you. I've never heard that.
Yeah, that's interesting. I didn't hear. I have never heard about that until I did, and then
Yeah.
I start taking it. There was about has been almost 7 months, maybe 8 months, and made a huge difference. Kind of, I sleep much better, and I feel like my hormones are more in balance. I mean, I feel good, really good. So, but you just mentioned vegetables, so that makes sense because that comes from broccoli. It's basically it's found in broccoli, so that makes sense too. What about healthy fats in general, like omega 3, eating salmon, all those healthy fats? Are they good for the brain too, as I have heard, or only coconut oil?
Well, they're not going to add fuel to the brain, um,
Okay.
but
Ah,
they're important building blocks for the body. So
right. So they're important too, but now for the brain specifically, that would be vegetables and
ketones and sugar.
yes, yes. So that's good to know. Gosh, I didn't know that. So the one that really, gosh, when I read in your book, so chapter 5, excess adrenaline, the bad, and chapter 6, excess adrenaline, the ugly. So that's really, it was a surprise to me to see depression, anxiety, hypertension, diabetes, but the emotional part of it, road rage, the bipolar, Post-traumatic stress disorder. So all that it's caused by excess adrenaline. Is that something that you're planning to present to medical school, universities, and see if they're willing, or to labs that they can do some testing and kind of somehow create a more in-depth study about this?
I didn't, you know, I have the feeling that they're not interested. I'll be honest.
Uh,
You may have heard of doctors that are called functional medicine doctors.
yeah,
Now, theoretically, a functional medicine doctor is supposed to treat the cause of illness.
right.
Now, my way of thinking is that unless you understand adrenaline, you cannot be a functional medicine doctor because there's so many conditions caused by excess adrenaline. So
Ah,
if you,
yeah.
and so I approached actually two schools that teach functional medicine. Neither one of them are interested. So that, I,
Right.
what can I say?
Yeah, that is sad too, though. So it seems like the system, the structure, is very closed to to anything else beyond of what they think they know.
Well, people need to become what's called proactive. In
Right.
other words, if they want to be healthy, they're the ones that'll have
Mm,
to. They
mm.
can't rely on a system that has no interest in their being healthy.
Yes, I love that. And that's why I have this podcast. Another question I have for you is about the cause of this excess adrenaline. So, because I know this, one of the symptoms is not sleeping well, right? Insomnia. Could that be the opposite to the contrary? Could insomnia cause excess adrenaline?
No, it's the adrenaline causes the insomnia. Um,
Right. Oh, it's always the case. That's incredible because sometimes we don't know, right? What caused what? So, what are the main causes of excess adrenaline? I would love for you to outline them so the audience know.
well, I mentioned that creative people usually have the most adrenaline, and
Yeah.
the reason for that is that the creative brain is always working,
Mm,
and
right.
so but the adrenaline is also responsible for giving people intelligence. So it's not all downside with adrenaline.
Right.
But you mentioned the word balance, and
Yes.
so what you need to do is just balance it out.
Yeah.
um,
Yeah.
and that's something that people can do without having to rely on their doctor. They can get the vegetables, they can get the coconut oil, they can get the MCT oil, and they can get progesterone,
Right.
which is my favorite hormone. And
Right.
they don't need a prescription for that. They can get that over the counter.
And I know you have on your website, I saw the products. So plotwellness.com. Yes, you have everything there. It's very clear. All the products are there. This is for men and women, Michael, for both.
Yeah,
Or
men stop making progesterone around the age of 50.
oh,
And it's
oh,
after the age of 50 they start putting on weight around the middle because they no longer have progesterone to block insulin.
right.
And they start getting prostate cancer because they have nothing to protect them from estrogen anymore. So um, the so the thing, but most doctors think that progesterone is a woman's hormone. They
Yes.
don't know that men produce progesterone,
Right.
but men and women have the identical hormones, different levels, but the same hormone.
Right. Right.
Um,
Oh, I didn't know that either. So both of us have.
oh
So
yeah.
we all need. I just thought about my husband here. He's 65, so he needs that. Yeah, I feel like it seems to me. I don't know. Have you have you noticed that men become more anxious than women, or they are naturally more anxious? There's something about. I don't know. It's something that I noticed. Is that something that you noticed too? That's easier for men to become more get imbalanced when it comes to hormones. It feels that way to me with
Well,
my
actually, yeah, you're right about that. Um, there are certain important hormones for both sexes. Um, testosterone is an important hormone for men, but it's also an important hormone for women.
right.
And yeah, hormones are important.
Yes, they are, it's funny that you said that, but it's I heard something interesting. Somebody asked a question about what are humans all about? What is one thing that makes up a human being? And I remember somebody giving that answer: hormones. that's what makes us humans, because it has to do with the emotions, right? It's very, very, very much connected to emotions. So
Oh
that
yeah.
makes so much sense. Gosh, let me go to my guided questions because. Oh, do you want to make a comment about that, Michael? Sorry.
No,
Let me go back to my guided questions because I don't have too many. Why is that never hear about doctors talk about adrenaline? So we already talked about this, the U.S. System. So why did you surrender your medical? Oh yeah, that's a question that I see here. Why did you surrender your medical license? Oh, I thought you retired. So you did that actually voluntarily?
no. Well, I did surrender it voluntarily, but if I didn't surrender it, they would have taken it away.
Ah,
And I've been in practice for over 40 years, and I've never harmed a patient.
mm,
The medical board never received a complaint from a patient, but
ah,
they received complaints from doctors.
right.
And what was irritating doctors is that when their patients came to see me, I took them off usually all their medications.
Mm,
And the reason for that, because I treat the cause of why they're on the drugs instead of just giving out drugs. And
right.
that's a real slap in the face to doctors. So
Yes.
they complained to the medical board that I was taking their patients off drugs. Now, the medical boards are controlled by drug companies.
Yes.
And so the fact that they have a doctor that's taking people off drugs,
Right.
they went after me more aggressively than any other doctor ever, probably in California, even though I've never harmed a patient.
Wow.
And they have doctors that are prescribing fentanyl to all these patients, killing patients, and that's okay. That's the standard of care.
Hmm.
It, but yeah, so
Wow.
I surrendered my license rather than having them take it away. But um,
Yeah.
it's been tough.
Yeah.
You can't beat the medical board.
So, basically, as you mentioned, it's all about profits and money. That's what the interest is all about. Because I know I cannot believe they're out there just to harm people out of nothing. So they're there to gain something that is financial gain.
Well, the problem is the doctors are not aware that they have alternative ways of approaching patients because they're not trained to do this.
Right.
If you have
Yeah.
when you're in medical school, you learn if you have a disease or a problem, you take a drug for it.
Yes. Mm. Yeah.
But the idea of treating the reason why they have the disease is not taught to them.
And it kind of surprised me that doctors are usually intelligent people, that they don't question the system, that they don't engage in studies, with curiosity. That actually is part of an intelligent mind. So I'm really surprised at that. So I'm wondering if there is a trade-off, again, has to do with not seeing certain things or not even looking for truth or being curious because you're being paid. So
Well,
that would be
you
sad
know,
too.
I- when I was practicing medicine, I had the luxury of being able to sit down and talk to them for at least an hour and a half or two
Mm,
hours.
yeah,
Doctors can't do that. They don't have time.
right.
So the easiest thing when they have a complaint or whatever, take a drug for it.
Yeah.
No problem.
So it's going to that easy, yeah, doing what it's easy, but it's never really, yeah.
Or time. Yeah.
Yes, right, right. Convenient, right? What is convenient, and what is not corrupted about the medical system? Is there something that we can still hold on to, in that sense, and
Well,
believe in?
like I say, that people, if they're concerned about their health, they need to become proactive. They need to take charge of it. And
Yes.
like I say, you can't rely on a system that has no interest in their being healthy. So they
Mm,
have to have, you know. So when it comes to treating adrenaline,
yeah.
they don't need a doctor. It's just a matter of eating correctly and using progesterone cream that they can get over the counter.
Yes. God.
And now, when it comes to progesterone, by the way,
Yeah.
most doctors, when they prescribe it, prescribe a progesterone pill,
Right.
like Prometrium. The problem is that when you take progesterone orally, it converts into a different hormone called allopregnanolone.
Oh.
This is not progesterone. So I never, ever recommend an oral progesterone, ever.
Ah.
Now, if they're going to get the cream, it comes in a lot of different strengths.
Right.
And the strength that I recommend is a 5% strength. 5% means that each pump is 50 milligrams. That's the exact strength you need to block adrenaline. So
Mm,
here you get progesterone. It blocks adrenaline. It
right.
blocks insulin. It blocks estrogen. It blocks the three most toxic hormones in the body.
Wow.
Everybody should be on progesterone.
Wow.
Well, I'm just
Gosh.
saying.
I'm thinking my husband got to be on that right away. Me too. Both of us.
And it's an incredibly safe hormone.
Wow.
I mentioned before you can treat colic in babies. I mean,
Yeah.
that's how safe it is. You
Mm.
just rub it on their belly, and the
Uh,
colic goes away.
oh,
And
that.
also, we I'm sure you have dog lovers in your.
Yeah, I have a dog. Yeah, of course.
Well, have you ever heard of something called separation anxiety?
Yes. Yeah.
Okay, that
Mm.
again, anxiety.
Mm.
Anxiety is caused by adrenaline.
Yeah.
So separation anxiety is caused by adrenaline in dogs.
Yeah.
So you can actually treat dogs with progesterone cream, and it goes inside the ear,
Yeah.
and it goes away in about 30 seconds. Those dogs that are scared of thunder or
Yes.
firecrackers,
Right.
separation anxiety. So progesterone takes care of all of that.
Oh
So
my God.
if it's safe enough for your dog, it's safe enough for anybody, right?
Oh, I love that. So, is that the same for the dogs? We can use the same one, the same cream, or
Exactly
we
the
need to
same.
buy a different one? Oh, the same
No?
one. The 5% one. I'm writing this down.
Well,
I'm very
you're
interested.
not going to find it from your vet or in
Ah,
a pet store. I mean,
right.
they don't know about this, but
Right. Oh my God, Michael, this is amazing. Thank you. Yeah, thank you so much. You see, education, what's not to love about it? And where do we apply it? Everywhere in the body or specific areas for better absorption?
okay. Well, normally it's put on the inner arms,
Yeah.
and you rub the two arms together. Okay. A lot of people that have excess adrenaline carry a lot of tension in the back of their neck.
Mm,
And this tension can do two things. It can cut off the circulation to the inner ear and cause tinnitus.
right.
So the back of the neck would be good there. And
Yeah.
then you have what's called the occipital nerve in the back of the neck,
Yeah.
which causes occipital neuritis.
Right.
Always mistaken for migraine headaches, occipital neuritis, always, 100% of the time.
Right.
But if you have occipital neuritis, you just put the progesterone cream on the back of the neck, it goes away within minutes.
Wow.
So,
Um,
that's what I'm saying. You're treating the cause now. You're not taking a migraine medicine, you're treating the cause, which,
wow. I had no idea. Although I read about it, but then talking to you, it's quite different. It's almost like there's a feeling to it. It's like the of sincerity, of this desire to help others. I mean, coming from the heart, and that's what I'm really in tune with and I'm interested in. So, because again, we don't want to do the same thing. It's not about money. We wanted really to help people, the way that they need to, that they
you
need care.
in my book, I talk about this fellow that came in to see me.
Yeah.
And the reason he came to see me is because every morning he would wake up and vomit.
Oh,
Now, what made this easy is that there's only one thing that'll cause that, and that's excess adrenaline.
wow.
So, and he had severe fibromyalgia,
Yeah.
which is considered incurable.
Yes.
Anyway, and that's also caused by excess adrenaline, by the way.
Right.
So, I put some progesterone cream on his inner arm, and he rubbed his arms together. And um, so we started talking again. And after about 5 minutes, he sat back in his chair and he looked at me and he said, "Doc, in my entire life, I've never felt this good."
Ah.
That's after 5 minutes of progesterone cream.
Okay, so 5 minutes after you already feel the effect, and how long after we need to apply again? Do we need to wait 2 hours, an hour?
Well,
How often?
what's nice about progesterone, you cannot overdose on it.
You can't. Oh,
And
good.
everybody's different because everybody uses, sugar differently in the brain.
Yeah.
So there's no one size fits all.
Wow.
But you can use it, anywhere from one time a day to 4 times a day to 6 times a day.
I can't wait to try it though. I wish I had tried it before so I could say it here live how wonderful it was, but I didn't try it yet. But I would love to try that to see. And my husband, especially, he's always anxious, always anxious. So he needs.
He'll like progesterone.
I know. Oh my God. Yeah, thank you. So I do in your book, you do have that. So chapter 9 is managing excess adrenaline, and you have the appendix A2, meal plan to lower adrenaline. So you have everything there.
Yeah.
Everything's there. It's just that it's an open secret in a way. That's truly beautiful. Thank you so much, Mike, for your for the grace that you bring to this human experience. We do need that. Yeah, we do need this. Your presence like yours here. So, oh, I want to mention, is there any question that I didn't ask? Is there anything that we left unsaid for this conversation? I'm wondering.
I don't think so.
I wanted to mention that I really love the dedication in your book. I dedicate this book to my wife, Victoria, who has never doubted me, especially during those times when I doubted myself. I almost cried when I heard this. I mean, I had to have it here. I mean, it's making me emotional now. It's truly beautiful. Thank you. Yeah.
Yeah.
Such a beautiful connection I see here. So thank you so much for sharing that too. That piece of your life, another piece. Thank you. Oh, I love that. She never doubted you when you doubted yourself. We need people like that. See, speaking of presences, beautiful presences in the world. Yeah, and that's thank you for giving back. Thank you so much.
Pleasure.
So I want to mention your website again. It's plattwellness.com. It will be clickable on the podcast notes. And before we say goodbye for today, Michael, what three things do you wish everybody to experience before they die? That's an open question.
Um, Something that everybody should experience before they die.
Yes. What do you feel is something that's
Well,
important before we die?
well, becoming aware of progesterone.
That's one. Yeah, now I am good. Yeah, I got that one checked.
By the way, they can also get my book on Amazon. And
Yes.
I mention that because it's less expensive.
Right. The link will definitely be there. Yes, we'll have the
And
link
they get,
there.
and
Yes.
if they they might get free shipping. So
Yes, yes, we'll have it here. Yes. So besides progesterone and your book, what are other things that comes to mind when you think about experiences to have before we lose the body, before we're no longer here? What can we leave here or leave with before we die?
um, making better decisions when it comes to electing presidents.
Yes, that's a good one too. Yeah.
Uh, the
Uh,
Well, when I see something like that,
yeah.
it doesn't make me very optimistic about.
Mm, yeah.
I mean, we get what we pay for. Yeah.
Mm, yes.
Anyway,
Yeah. Thank you for
I
saying
just
that.
wanted to get my 2 cents for that. I'm just saying.
Yeah, thank you for saying that too. Right. Yeah, thank you. Thank you. And I do hear you. Thank you so much again for your beautiful presence, and we'll talk soon. We'll be in touch again, Michael.
Okay.
Bye for now, my dear. Take good
Adios.
care.